Okay, let's get into it. Today we're doing a deep dive into an experience that can cause a lot of worry, but it's one that's surprisingly common, especially for men as they get a bit older.
It's a topic that's so often just buried in silence, and
Mm.
that leads to a lot of unnecessary shame, a lot of anxiety. We're talking about a very specific physiological change.
Right.
The man feels that full, intense rush of a sexual climax. I mean, the complete neurological sensation of pleasure. But there's very little, or sometimes no, seminal fluid. Medically, we call this an ejaculation.
And the sources we've looked at confirm that the reaction is often just instant panic.
Yeah.
So our mission today is really straightforward. We want to break that silence, take away the fear, and just state clearly that this is not a sign that a man's masculinity is failing.
Not at all.
It's more like a very precise internal message from the body, something that needs attention, not distress.
That anxiety is really the first thing to tackle. I mean, just imagine the dissonance. You feel this profound pleasure, but the physical evidence you've expected your whole life just isn't there. For men, especially over 60, it can instantly trigger this fear of failure.
And they just shut down.
They shut down. They often just start to avoid intimacy rather than ask what's going on.
Because that fear, it hits right at the core of your identity.
Mm-hmm.
If everything feels right, the absence of the fluid feels like a mechanical failure or, worse, a personal one.
But this is where the science comes in, and it provides such massive relief.
Yeah.
We just have to separate two functions that, well, we've all been taught to link together very, very tightly.
Okay, so what are they?
We need to clarify the fundamental science. We tend to lump these two events together, but they're related for sure, but they are functionally independent. So on one side, you have the orgasm, the climax.
The feeling.
The feeling, exactly. Yeah. The neurological event.
Mm-hmm.
It's the rush of endorphins, the muscle contractions, that intense sensation of pleasure. That's one thing. On the other side, you have ejaculation. And that is purely a mechanical process. It's the physical expulsion of fluid. So anejaculation means the nervous system, the desire, the erection, the capacity for pleasure, all of it is working perfectly.
So you're saying the core experience is completely intact?
100%.
Mm.
The man feels the climax, but the mechanical part, the fluid expulsion, is what's absent or reduced. It's often called an empty climax, which is a pretty accurate description.
So the first message right now for anyone listening is your capacity for pleasure, for closeness, it's fundamentally sound. The issue is mechanical. It's plumbing, not a personal failure.
And that distinction alone, you can just feel the psychological burden lifting. It absolutely does. When men understand that the pleasure is proof, the core system is working, the conversation immediately shifts from what's wrong with me to, okay, what's blocking the pathway?
So let's investigate that pathway. If the sensation is there, what's actually changing on the mechanical side? We dug into the research, and there are basically three core causes. Let's start with the one that's statistically the most common.
Right. That would be retrograde ejaculation. To get this, you need to picture the system like like a complex junction where the urethra meets the bladder. At the neck of the bladder, there's this small muscular valve, a sphincter.
The little gatekeeper, essentially.
Gatekeeper is a perfect analogy. Normally, when the body gets ready for ejaculation, that gatekeeper snaps shut. It has to.
To direct traffic.
Exactly. It directs the seminal fluid path outward, making sure it doesn't go backward into the bladder. With retrograde ejaculation, that little valve it fails to close all the way. So the fluid takes the path of least resistance.
And goes back into the bladder.
Straight back into the bladder instead of out of the body.
That makes so much sense. So the volume is still there. It's ending up in the wrong place. Is there an obvious sign that this is what's happening?
There is. And this is such a key piece of information. It can really help you figure things out before you even see a doctor. The urine, right after climax, will often look cloudy or a bit milky. And that cloudiness is simply the semen mixed into the urine. It's harmless, and it just passes out the next time you urinate.
That immediately solves the mystery for a lot of people, I'd imagine.
Sure.
So what causes this gatekeeper to fail? Is it just aging?
It's not really aging itself, but more the conditions associated with it. The most common triggers are actually side effects from treatments or certain chronic illnesses.
Oh.
We see it a lot after some prostate operations, especially for an enlarged prostate.
The surgery affects the valve.
The surgery can inadvertently impact how that bladder neck sphincter functions.
Is this?
Also, some medications can do it, certain drugs for high blood pressure, some antidepressants. They can relax that muscle.
Okay.
And crucially, uncontrolled chronic diabetes is a major factor. Over time, high blood sugar damages the very fine nerves that tell that muscle to contract properly.
Right.
The source material had this story about a patient who was in just immense emotional distress after his prostate surgery, but he found this deep, immediate relief when he finally understood it was just a mechanical routing error, that his vitality, his masculinity was not harmed.
That relief.
Yeah.
It just speaks volumes about how much mental space this takes up.
Uh-huh.
It's amazing how understanding the mechanism separates the physical fact from that feeling of personal failure.
Ah.
Okay, so moving on from the open valve, what's the second big cause?
The second cause is a blockage, an obstruction in the seminal ducts. So while sperm comes from the testes, the seminal vesicles in the prostate actually contribute most of the fluid volume,
The bulk of it.
the vast majority, and that fluid travels through these little ducts and tubes.
Mm.
If those channels get blocked, the volume just plummets or disappears completely. Think of it like a blocked drain under the sink.
What would cause a blockage like that?
Often it's scarring from previous infections that maybe weren't fully treated, like chronic prostatitis. It can also be caused by tiny calcifications like little stones similar to kidney stones. Or, more rarely, it could be a congenital thing that's just discovered later in life.
Are the symptoms any different with a blockage versus their retrograde flow?
Sometimes, yeah. With an obstruction, you might notice that what little fluid there is seems extremely thick and less abundant. You might also have some mild sort of localized pain in the pelvis or groin, especially if there's inflammation.
Okay.
The good news here, though, is that a lot of these blockages are very manageable. Often it's just a course of anti-inflammatory medication or sometimes a minor procedure to clear the duct.
That's really encouraging. So our third cause moves us from mechanics into chemistry, hormonal imbalance. We always think of low testosterone and desire, but it clearly affects the plumbing too.
Oh, absolutely. Low testosterone isn't just about libido. It's the essential fuel for all the reproductive glands, the seminal vesicles, the prostate. They all need it to function. When testosterone levels drop, what we call hypogonadism, the output from these glands just diminishes.
This means less fluid.
Less fluid volume, exactly.
And what are the other symptoms that might help someone connect the dots here?
The symptoms tend to be more systemic. So yes, decreased fluid, but also reduced desire, erections that are maybe less rigid or reliable, general fatigue, and even mood swings or a loss of motivation.
This is a really crucial point. It is so easy to just write all of that off as normal aging and assume, nothing can be done.
We have to push back against that narrative. We really do. These symptoms should not just be passively accepted. Hypogonadism is a diagnosable condition, and the first step is so simple. It's a blood test.
Just a simple blood test.
A basic blood panel can spot low hormone levels, and once it's identified, hormone treatments can restore gland function, increase fluid, and just improve the overall quality of life dramatically.
Understanding the why really gives you a path to control. But before we get to the final action steps, we have to cover the serious warnings our sources flagged. Because sometimes an ejaculation can be an early warning sign.
Yes. It can absolutely be a distress signal for something more serious. We have to talk about the red flags that need urgent medical attention. This includes things like tumors, prostate, or bladder cancer, for instance, that can physically grow and block the passageways.
A physical blockage from a pathology.
Precisely. And also progressive neurological disorders. Things like multiple sclerosis, Parkinson's, or severe diabetic neuropathy can disrupt the nerve signals needed for the whole process to work.
So what are the immediate non-negotiable red flags?
The presence of visible blood. In the urine or in any fluid, sudden acute pain, or any new and sustained loss of sensation in the genital area. If any of those things appear, you need to see a doctor immediately.
That is crucial advice. Okay, let's pivot to the emotional toll, because the physical issue creates this vicious cycle of isolation and shame, right? Leading men to just avoid intimacy altogether.
That cycle is maybe the most damaging part of this long term. If a man feels shame about his body's output, he internalizes it and pushes away closeness. He assumes his partner will judge him or that the experience is a failure for them both.
Now we have to just dismantle this idea that intimacy is measured in milliliters of fluid.
Exactly. The cure for the shame starts with understanding. Just realizing that this is a predictable, common, treatable physiological change and not some mark of personal deficiency that lifts an enormous psychological burden.
Yeah.
Intimacy, connection, pleasure, it's all driven by sensation. sensation, by emotion, by trust, not by mechanical output. Understanding that is, it's the key to healing and restoring confidence.
So to wrap this all up, the sources offer 5 really critical action steps. They frame it as an investment in your future. Let's run through them because this is the practical roadmap.
Okay, step 1. Break the silence. This is the big one. Talk to a trusted partner, and most importantly, talk to a physician. Communication is the first step to regaining power.
Step 2. Seek control. Don't just assume it's aging. See a urologist or an endocrinologist. That's the strongest move you can make toward getting a real diagnosis and taking back control of your health narrative.
Step 3 is manage underlying health. That means strict control of your blood pressure and especially diabetes. Since nerve and vascular damage are so often the culprits here, managing those conditions is just critical preventive medicine.
And step 4 is about lifestyle. Adopt a healthy lifestyle. This is the stuff we know, but it matters. Regular, light exercise like walking, eating foods rich in zinc and vitamins. The sources mention walnuts, pumpkin seeds, pomegranates, and maybe most importantly, prioritizing early, restful sleep.
The body repairs itself during sleep. And finally, step 5. Adhere to medical recommendations. Seriously, follow through. If a doctor suggests medication changes or hormone treatments or screenings, consistency is everything.
The sources close with so much hope. They've seen men in their 70s, even 80s, regain their joy and confidence just through understanding, care, and taking the right steps.
And really, true masculinity isn't defined by a quantity of fluid. It's defined by the capacity to listen to your body, to be vulnerable enough to ask for help, and to take decisive action. So the question to leave you with is, what shift in mindset do you need to make to fully embrace the knowledge that the best years of your life might still be ahead?
A powerful and essential thought. We hope this deep dive has provided some clarity and, most of all, some relief.